Hi, my name is Dr. Tina Stefanski, and I'm the Regional Medical Director for the Office of Public Health in Acadiana. HPV is more than just a three-letter acronym. It's short for human papillomavirus, a serious virus that can cause various cancers later in life. Cervical cancer is the most common. According to the CDC, more than 9 out of every 10 cases of cervical cancer are caused by HPV. Knowing more about HPV is essential to protecting your health and the health of your family and friends. And you might be surprised to learn that HPV is common, very common. According to the CDC, more than 42 million Americans are currently infected with HPV. And that's not all. Every year, approximately 14 million Americans, including teens, develop new infections with HPV. What makes HPV so common? HPV is most commonly spread through sex and through close skin-to-skin contact during sex. And a person can spread HPV during sex even when they have no signs or symptoms. And approximately 90% of men and 80% of women who are sexually active will become infected with HPV during their lifetime. But fortunately, doctors and scientists have figured out a way to protect us against HPV. In the 1990s, they developed a vaccine that now, according to the CDC, has the potential to protect against 90% of HPV-related cancers. And it gets better. Since the HPV vaccine was first introduced, infections with the types of HPV that cause most cancers and genital warts have dropped more than 80% among teens and young women. And while HPV is still a serious threat to the health of young women, young men are also at risk. Nearly 4 out of every 10 HPV-related cancers occur in young men. And the HPV vaccine works best when given before exposure to the virus. And even if you've only had sex with one person, you can still get HPV. That's why it's so important that someone be vaccinated against HPV before they become sexually active. Given that, the CDC recommends that children age 11 to 12 years of age get 2 doses of the HPV vaccine, spaced 6 to 12 months apart, and the vaccine series can be initiated as early as 9 years of age. For those who were not vaccinated during those ages, it is still routinely recommended that a person be vaccinated through age 25, and in some cases through age 45. So we recommend that young adults talk to their healthcare provider about the HPV vaccine. So, is the HPV vaccine safe? The answer is yes. The HPV vaccine has been proven safe and effective at preventing most cases of HPV-related infections and cancers. Most people who get the HPV vaccine have no side effects at all. And for those who do develop a side effect, it's typically a sore arm at the site of the injection. If you want to know more about the HPV vaccine, we suggest you speak with a healthcare provider that provides care to your child. You can also visit immunizations.la.gov, the Office of Public Health immunization website. It's got lots of great information that you can use to help guide your decision to vaccinate your preteen.